When I come in and help out a hygiene team, we want them to be individuals with their patients because patients love different hygienists for different reasons. But what we don't want is if you start with one hygienist and end with another, or you come back in 6 months, like a completely different process. It is about what they say, it is verbiage, we definitely get into that, but it's really more about the actual process. We want to make sure it aligns with the doctor's philosophy, because a lot of times I'll come in and work someplace, I'm doing my thing, and my dentist may not even know until maybe a challenge arises. So we want to make sure that our philosophies align, we're all calibrated, and then we want a standard operating procedure. If a new hygienist comes in, whether it's a change of the guards or we're adding a new one, that they know exactly what and when. One of the advantages that I bring as a hygiene consultant into a practice when doing a hygiene program, part of it's being a practice owner. Because, you know, when my hygiene chair was empty of patients, I felt the same way they did. I'm paying that hygienist X amount of dollars an hour and there's no patient there. I think if a hygiene program isn't as strong as they want it to be or it should be, and they don't choose to change it, I feel like some things they would be missing out on is number one, they're probably paying their hygienist more than they're making out of that chair. So they have a loss of revenue. Times have changed a little bit, so I'd say every dollar out of hygiene is at least $2, if not $3 of diagnosis and restorative. So, you know, it's gonna affect the restorative part. I think if a dentist is asking, should I bring on a hygiene consultant or bring in a hygiene program, they probably already know the answer, because I don't think you'd be asking yourself that if you didn't think that there was some kind of weakness or challenge there. One of the key indicators out there is that hygienists should be producing, 3 times their wage. I go into so many practices and I see that hygiene department is a loss leader. In today's wages, paying the hygienist more than we get for, a procedure sometimes. If you're out there and you're wondering if your hygiene department needs help, or they need help, sitting there doing nothing is probably going to be the most costly mistake you can make. It's worth a call, it's worth a conversation, and then seeing if it fits for your practice.